So welcome everyone. Thank you for coming this evening. I'm Judd from York Hospital, and I'm just going to do some introductions and be available this evening. You are making history tonight. It might not feel that to you, but you are making history. This is our first Diamond Dialogue, so welcome. Glad you all are here. On the topic that's going to be discussed tonight, there are a variety of opinions and perspectives. We wish to acknowledge different perspectives and different opinions, just as long as we exchange those respectfully to everyone in the room. It is my pleasure to introduce our esteemed panel. I'm going to start with the thorn between two roses, Dr. Richard Lampert, who many of you probably know. As a bit of background, Dr. Lampert is a graduate of Bowdoin College and received his medical degree from the University of Vermont. He did his residency at Shands Teaching Hospital in Gainesville, Florida, and did a fellowship in pediatric endocrinology at the Oklahoma Children's Memorial Hospital in Oklahoma City. He is board certified in pediatrics and pediatric endocrinology, and he has been practicing in York since 1987.
That's correct.
How'd I do?
Good.
Okay, good.
You got it.
I'm also pleased to introduce Kyla Scarponi. Dr. Scarponi received her bachelor's degree from Northeastern University in Boston, her doctorate degree from the University of New England, internship and residency at University of Medicine and Dentistry, New Jersey, Robert Wood Johnson Medical School, and is board certified in pediatrics. She grew up in Toms River, New Jersey, and moved back to this area because her husband is from Portsmouth, New Hampshire, and they both love New England. And they have an almost 6-year-old son, Ian, and a 2.5-year-old daughter, Liv. And Liv has a Cinderella jacket and Donald Duck and
All right.
Donald Duckus garden gloves.
She does. We saw each other at the.
We saw each other in a hardware store. And I'm also pleased to introduce Kelly Parpamello, who also practices pediatrics. She received her bachelor's degree at the University of Maine in Orono, her medical degree from Albany Medical College in New York. She did a residency at Maine Medical Center in Portland. She lives in York with her family. That includes both a son and a daughter. She has an interest in international medicine as well as integrative medicine. And if you've ever seen her beautiful photographs of her journey to Africa, they are astounding. So a little background on each of them. I'm just going to hang and be helpful. They're going to make, the doctors are going to make a bit of a presentation and then conduct a dialogue and exchange dialogue with all of you and address your questions and interests. So with that, I'm pleased to introduce Dr. Lampert to start the evening off.
Thank you, Judd.
You're welcome.
My perspective is just going to be based on my age, because I'm old. I was born in 1948. I have friends in the 50s who had polio, which we don't see anymore. When I was training for my residency and stuff, I had people that had meningitis caused by a bacteria called Haemophilus influenza. We immunized for that. We don't see that anymore. We saw patients with epiglottitis, where the little bud thing in your throat swells up and you can't breathe, caused by Haemophilus influenza meningitis. We don't see that. I had people with meningitis caused by pneumococcus, which we don't see anymore because of the vaccine. So you're probably guessing I'm pro-vaccine. We don't see people with measles encephalitis, which is a brain infection. We don't see people that get sterile because they've had mumps. We don't see a lot of cancers caused by some viruses. So I guess I'm on the vaccine side. We would encourage everybody to immunize. Anyone else?
Yeah, just to add to that, I've been at this practice for about 5 years now, and I have not seen any of these diseases because of vaccines, which is I'm very, very thankful for. And I'm sure that Dr. Parker Mello can add to that too. A lot of these things that we learned about and read about and we've never seen because of the vaccine. And so our group in general is very pro-vaccine. We understand about the different state laws and different things like that, and things are different in every state. We definitely understand that. But our general recommendation is definitely for preventing disease.
So I guess the way that I approach vaccines when I talk to patients is, like any other topic in pediatrics, we're here to help people weed through a lot of information. And being someone's pediatrician is really about being, your partner in how to help raise your child to be healthy and happy and all those great things. And so I think we really wanted to open this up as a dialogue to kind of just talk about what are people's concerns, what are people's questions about vaccines, fears about vaccines and things like that. This is such a huge topic and such a charged topic, I think, for a lot of people. It's really hard to weed through the massive amount of information out there. It's really hard to know what information is good, accurate information. If a study is done, what does that mean? And how do you know, is this a legitimate study? There was a very interesting Facebook post the other day quoting a study from JAMA, which is the journal for the American Medical Association, and the abstract was up on Facebook and people were commenting, and it was very interesting from a medical perspective to read that abstract and to look at people's comments, because many people were reading the same little article, pieces of information, and taking away very different opinions from that, or very different messages. Some people thought it was saying one thing, other people thought it was saying another. So we don't want to talk at you and feed you information that is not even on your radar. But I think kind of just we'd like this to be just an engaging conversation about questions, concerns, how can we help, what is it that, people think about when they think about vaccines and that kind of thing. So I guess I'd like to turn it over to you guys and, feel free to, ask any questions, ask pros and cons of different things.
As a senior, I've had a lot of health issues, but I keep saying no, I don't want any more vaccines of this anymore. I don't even take I can't say the word, but so should I be getting more vaccine? I don't want any more, but I think I probably should be doing something more as a senior. What do you think?
Well, as a senior, as a fellow senior, they probably want you to be immunized for herpes zoster, shingles. That's a great vaccine. And I would only add that if you have the chickenpox vaccine when you're younger,
No.
you probably, you had chickenpox like I had chickenpox. But if you get the chickenpox vaccine and never have chickenpox, you're probably never going to get shingles.
Oh.
But anyway,
So
to speak to your thing, if you've had chickenpox, you're at risk for shingles. And it's a good idea to get the vaccine. And the other vaccines for older senior people, there's vaccines for pneumonia, pneumococcus. That's the bacteria that causes it. And there's a vaccine for that, and there's actually 2 vaccines for that. They're recommending a vaccine that we give to kids now for pneumonias for seniors. And then you ought to make sure you're up to date on your tetanus shot.
My tetanus shot. Oh, for my trip to Rome, to Italy.
Well, not necessarily for your trip, but any exposure. There's a lot of children that are too young to get vaccinated against certain things, and so if they're exposed to people who have an illness, then those children are at risk of developing an illness that they weren't even able to get vaccinated against. So pertussis, which is whooping cough, a lot of children can't get their first pertussis vaccine until they're 2 months old. And so if they're exposed to somebody who has whooping cough, then they can get severely ill. As well as other, especially pneumococcal. So pneumococcal, the vaccine for what Dr. Lampert was talking about, we do a 13 valent immunization for children, but there's a 23 valent pneumococcal, which just means 23 different types of bacteria that cover against pneumonia, ear infections, meningitis, all different things. And if those children who are not immunized yet are exposed by somebody who may be older than them who possibly has that infection, that's also a reason to immunize, so that you're not spreading the infection to somebody who cannot be immunized or is at higher risk of getting the infection, not only to protect yourself, but to protect others. So that would be a good
Thank you.
I think on that topic, when people come into our office and they're having a baby and they say, what should I do? What do I need to get? I think the pertussis is a great example. So pertussis is the whooping cough. And if you or I get pertussis, we might just seem like a cold with a cough. It might not really be that big of a deal. But if a newborn baby or a young infant gets pertussis, it can be deadly. It's really this very, very intense, long, drawn-out cough. When there was a big pertussis outbreak in California, there were a number of infants who died. Many of them were too young to be vaccinated. And it's also not a great vaccine, which just means you need it a bunch of times to have some good immunity. So they get a pertussis vaccine at 2 months old, and then they get another one at 4 months old, and another one at 6 months. And it really takes until that third dose at 6 months until they really have decent immunity against pertussis. And what we know is actually moms are the ones who pass pertussis to their babies. They're the ones holding their baby, breastfeeding their baby, just that close contact. And so there's a CDC recommendation that anyone who's going to be caring for an infant or in close contact with an infant, all adults have a pertussis booster. So if you had pertussis shots when you were a kid, you probably don't have any immunity anymore. Your immunity's probably worn off. So if you're going to be caring for a young infant who doesn't have any immunity against that, you're really putting that infant at risk if you're not immunized. So the way we protect our infants and the way we protect our vulnerable populations of people, elderly or people who are on chemotherapy and don't have good immunity, is by immunizing the rest of us to prevent spread of that disease. So I think that's one reason to think about, if not for your own health, maybe the health of those who are vulnerable around you and not wanting to spread those diseases to those people.
Does that mean, as my daughter having a baby, we got the pertussis, my husband and I?
Yep.
Does that mean that in 5 years we get it again? How often should we get it?
That's a good question. The CDC isn't quite sure yet. The new recommendation for that booster for adults, so pertussis vaccine is part of the tetanus. It's the Tdap that adults get. And so oftentimes adults would go into their doctor to get a tetanus booster every 10 years. You'd get the TD, tetanus and diphtheria. They've recently said that we should be giving people the Tdap, like you've gotten if your daughter's expecting. And there's not right now a recommendation for a second booster 10 years later. Right now we're saying adults get a one-time booster. They are saying to pregnant moms with every single pregnancy, you should get a booster of pertussis because we know those moms are the ones passing it on the most. So the dads right now, you get away with one shot. The moms, we're saying, you know, it's that much of an issue and it's that risky for your baby to get pertussis. So great question, things change as we learn more, as we understand more, you know, maybe 10, 20 years from now, we'll say, yep, that immunity wore off. It's a good idea to get another one.
My teenage daughters have or are in the process of getting the HPV virus, cervical cancer, whatever. Vaccine. I know it's relatively new on the scene. Can you tell me a bit about how this all came to be, that within the last 5 or 6, 7 years, all of a sudden the CDC is highly recommending that teenage females get this vaccine?
So the vaccine has been out for about 9 years now. And they're finding that about 70 to 85% of adults have HPV in one form or another. And so HPV, human papillomavirus, there can be many, many strains of this virus. And there are certain strains that can cause cancer. And so what this vaccine covers is, right now, there's a 4-valent, meaning it covers 4 different types of the virus that can cause cervical and vaginal cancer. There are also some associations with other kinds of cancer, like anal cancer and maybe even throat cancer. So, you know, this vaccine is our only vaccine that we have that protects us against cancer, actually. So it's an excellent vaccine. And we're in the process, and I think we're almost there, of approving a 9-valent, which means we cover 9 different strains of the virus, to give that to our teenagers. And we start giving this vaccine at 11. It can be given as early as 9, but the reason we give it so early is so that we protect these children before they have any exposure. And so sometimes it's kind of abrupt when we talk about covering against a virus that you can get from having sex. But when we do it early, we know that we're preventing them from exposure. So that's the reason that we do it so early. I don't know if anyone wants to say anything extra, but.
And it's not just females. We're recommending it for both males and females, because the same virus can cause, besides, as Kyla mentioned, anal rectal cancers, but genital penile cancers. So it's a win-win situation, basically.
So what is this will this help protect young men from getting prostate cancer in the future?
Prostate cancer is not included on the list, because I don't believe prostate cancer is caused by human papillomavirus. But it's only cancers that are caused by that specific virus.
So the vaccine that's out right now has 4 types of HPV that it covers for. 2 of the types cause about 70% of cervical cancers, so it's not perfect. So when Kyla said that there's actually going to be a better vaccine coming out soon, that's great. Hopefully we can get that number higher. And then it also covers 2 of the other strands cause about 90% of genital warts. So HPV is actually the virus that causes warts on your skin. Little kids who get warts, it's from HPV. It's not necessarily the same strands of HPV that are causing cervical cancer or genital warts, but it's just a virus that's out there and it's everywhere. And so it's a pretty amazing thing to be able to give a vaccine and prevent cervical cancer. But we're learning more and more. Tongue cancers, throat cancers, rectal and anal cancers. So we know that if we protect both men and women from this virus, men won't spread it to women and vice versa. So,
is there any early indication of how well it's being accepted in this time frame that it's been available to?
Do you know the numbers?
I don't know our numbers from our office, but we offer it to every 11-year-old visit for child checks. I think we do pretty well in our office, and I think the children who get the vaccine are doing really well. I don't know the long-term data of whether or not it's going to decrease I think we have to wait a little bit longer to see if that number from 70 to 85% is going to decrease to be less. And in addition to preventing the cancers, it's also going to prevent a lot of procedures that these women are going to have to undergo. You know, if you have an abnormal pap smear, they're going to have to go all these uncomfortable procedures to determine what the cause is, and if the HPV is negative, they may not have to undergo those procedures. So it's a definitely great vaccine.
Thank you.
Mm-hmm.
So if a young girl had had the vaccine 9 years ago, would you recommend the girl coming back again and having the newer version?
So we don't have that information yet. We've been asking the same questions ourselves to our representatives from the pharmaceutical companies. We don't know what their recommendations are going to be, if they recommend doing another 3 series of vaccines, or if they feel like they're going to be covered enough. So we don't have that information yet, but as soon as they do, we'll let you know.
I mean, the suspicion is with the new vaccine that we're going to at least do a booster dose.
Maybe one booster.
One. And maybe all 3, but I doubt that. We'll have to find out. But I think they're going to say you should at least do a booster dose of the 9-valent vaccine after the 4.
That's a great question.
I found it very interesting on vaccines having mercury in them and formaldehyde for preservatives. Is it across the board throughout the U.S., no more mercury in your vaccinations? Or do you have to, how vigilant does a parent have to be? If you're here and you go out to Colorado, are you going to have to say, oh, I've got to check what they do there?
There's no mercury in our vaccines, but there is formaldehyde in some of the vaccines. And the reason for the formaldehyde is so that it inactivates the viruses or infections from being active. So if you're given something in a vaccine form, you don't want it to cause the infection. And so what the reason is for that is to inactivate it. Very, very tiny amounts, smaller than in cigarettes. So it's not been shown to cause any problems.
So is mercury out of all vaccinations?
No.
It's
No.
not out of
They're adult.
vaccines.
If you have a multi-dose vial of a vaccine, it's going to have a preservative that contains mercury. But you're a teenager or a young adult.
Not in the younger.
Yeah, so
Yeah.
I can talk a little bit about mercury. So the mercury that has been in some vaccines has been used as a preservative, and specifically, usually it was in the form of thimerosal. That form of mercury is very interesting. So we all know mercury is bad for us. It's a heavy metal. It's like lead, it's like arsenic, those kinds of things. Those heavy metals get in your body and you don't get rid of them. So in high levels, they can deposit in your brain and things like that. That's why eating a lot of swordfish or a lot of shark or the big fish that eat smaller fish have high levels of mercury. And we don't recommend that for young kids. They have developing brains that are pretty important. And so what is very interesting about this topic is that I absolutely agree mercury is not good. I don't want my kids to have it. It's not a healthy thing. But there are different types of mercury, and I think that's important to know. So the mercury that comes from power plants and that gets deposited into our oceans and rivers and is in these large fishes is actually methyl mercury. Methyl mercury has a half-life of years and years. So in other words, it doesn't break down. It takes a really long time to break down, and it just builds up in your system. Thimerosal is actually ethyl mercury. So it's a different type of mercury. I'm not saying ethyl mercury is healthy. I'm not promoting that. But ethyl mercury has a half-life of a week and a half. So in other words, it does break down at a faster rate than what we think of as mercury, not meaning that it's healthy, but just meaning that it's very misleading to think, oh, mercury is mercury, and it's not, And so just to kind of put that point out there of sometimes things aren't necessarily what they seem. Now, I still don't really want my kids to get vaccines with ethyl mercury. Why give them stuff that's unhealthy if we can help it? And the good news is that almost all the pediatric vaccines now are single dose vials. So in other words, we get a box, the nurse either takes just a needle and hooks it to the syringe, and then the syringe gets thrown away after one use. So anything that is single dose or drawn up one time and thrown away, anything that's single dose is going to have less preservative because you don't need to keep it in your fridge for 6 months. When you get into multi-dose vials, that's when there's more preservative. So adult flu is often a multi-dose vial. When you give polio as an individual vaccine and not as part of a combination, that's usually a multi-dose vial. So you will have more preservatives in those. It's very easy in most pediatric practices to avoid multi-dose vials. And it's a great question to ask. You want to be asking your pediatrician about that. And I actually talk about that when people are thinking about slowing down their schedule, when people want to separate them out and don't want to do any combo vaccines. You have to be aware that by separating them out, you are talking about sometimes some multi-dose vials. So it's more overall preservative than sometimes if you did a combo vaccine that was a single dose vial or a single dose.
Right. And there's other things also in vaccines that are called adjuvants. Adjuvants are things that help your body absorb the vaccine and help you respond better to the antigen, which means just helping your body protect yourself against that vaccine. And so there are things in vaccines for that reason. And so, like I mentioned, the formaldehyde, that's kind of a big topic, but that's actually helpful for you to not actually get the illness and be able to develop some immunogenicity against that virus or bacteria and be able to produce your own antigens so that you can protect yourself against the virus or bacteria. So there are certain things in there. Formaldehyde in large amounts is not good, but in small amounts has been okay. So it's not there, there's a lot of other things, like we were just talking about that. The amount of formaldehyde in cigarettes is much larger than there are in a vaccine. So
not that we promote smoking.
Yes, so
no,
don't
we
smoke.
don't promote smoking. So that was a great question too.
Yeah.
Do you guys address the recent media and medical journal stuff about autism and vaccines?
Yeah, I
All
mean,
the time.
all the time. I don't know. Do you want me to start?
Sure.
The Lancet. We'll
Sure.
start with
Yeah,
the
I
Lancet.
think giving a little history
I
is
think,
helpful.
I think you should give a history about
I don't know
this.
what year the Lancet published this
The
article.
Lancet's a medical journal in England.
So there's a
Very
medical
prominent
journal
medical
published that published an article in England years ago, before I was practicing, that it was a very poor medical study, and in the medical community was not well respected. And it suggested that autism was related to vaccination, specifically more to like an MMR vaccination. And so, and I'll just speak from my perspective as well. But as a resident at the time of learning about this, it was not a well-respected study. It wasn't a well-done study. There's ways of reviewing different medical studies and anything can really get published. So you have to review a study to make sure that it's well done. This study was published and, just in the medical community, it was not very well respected. And so there weren't a lot of subjects in the study. Eventually, the person who wrote the study and published it came out and said that he falsified the study. And so this whole knowledge and basis of how autism is connected to vaccines was based on a falsified study.
Oh my goodness.
Mm-hmm. And so I think we spend a lot of time educating people about this study and why. And we have a lot of information available to us everywhere. Doesn't mean that all of the information is correct. And so
Was he a doctor?
Yes.
He's lost his medical license.
Yep.
He lost his license, and recently, maybe a year or two ago, the Lancet retracted the paper,
Mhm.
which is a very big deal for a medical journal to retract an article. Specifically in the MMR vaccine, the link from this study, I believe, was thimerosal, that, ethyl mercury. And what kind of happened over the next decade was that pharmaceutical companies took thimerosal out of most of their pediatric vaccines. Those single-dose vials no longer have any thimerosal in them. And millions of dollars have been pumped into very large studies to look at populations of children who have autism, populations who don't have autism. And actually there have been some very large studies that have said the numbers are the same. So in kids who have not gotten vaccines, they have the same amount of autism in both groups.
There's no link.
So there's no evidence that the measles, mumps, rubella vaccine causes autism.
Yeah. So it's been interesting, and I think a lot of people question that a lot less than they used to. Of course, they're your children. You want to protect them in every way you can. But I think we believe that vaccinating them against these potentially deadly diseases isn't putting them at risk for autism, and actually is doing best by them.
Since you two are pediatricians, then you're trying to figure out autism with children. Are you going to say it's related to our food? Are you going anywhere near that?
We don't know what it's related to, and there are a lot of studies that are in progress right now to determine
So
that.
over the
There's
next
no,
5 years,
hopefully,
Okay.
we don't have an answer to what it's caused from. We don't know right now.
And I think that's scary. It's scary for us as pediatricians. It's scary for parents. We know autism is on the rise. Even if you control for, we're better at diagnosing it than we were 50 years ago, there's more autism today. 1 in 85, children. It's high, and it is very scary. But a lot has changed in our environment in the last 50 years. There's a heck of a lot more chemicals, a heck of a lot more plastics. And I think there are some very easy things that we can do as parents to control some of our environmental toxins that don't jeopardize the health of your child or put them at risk for diseases by doing those things. So it's scary because we don't know. I'm not a fan of plastic, as I'm
Plastics.
drinking out of a plastic bottle.
Yeah, see,
I'm not gaining brain cells
See that?
anymore. My
So
children.
recently there was, I think there was a measles outbreak? So should I not take my grandchild to Disney?
World or
Well-
land? Which are we talking about?
Yeah, so
Disneyland.
Disneyland, there was an outbreak of measles, which spread to over 17 to 19 different states, actually. I think the closest to us was New Jersey, I believe. And so they have declared that it's over. The outbreak is over. I did receive notice of that. The outbreak is over. But since then, I have read that California has now made it a law to vaccinate, which certain states have. Our state, Maine, we do not have a law that they have to be vaccinated to go to school. Certain states are. Mississippi is actually the best vaccinated state in the country. They have a law that all their children have to be vaccinated to go to school. And from what I heard, we are the third worst vaccinated state in the country. So,
So
you know,
those other
it-
states are not allowing religious or like.
right.
Really?
No
Right.
philosophy.
Maine
Right.
allows religious
We
or
do.
personal
Yeah.
Right.
exemptions.
I thought they probably.
So certain states do not allow any of that, and their children will not be able to go to school if they're not vaccinated. So, but we do here. So, however, if they're not vaccinated and there is an outbreak, there is some fine print that if there is an outbreak of something, for example, chickenpox, those children who are not vaccinated will have to stay home for a period of time, which could be up to 2 weeks or longer, not allowing them to go to school. So they do that here in Maine, just to protect those children who are not vaccinated. So
Just for nosy on daycare. If you're running a daycare, what are those adults supposed to have? And what kind of requirement between New Hampshire and Maine? Is it different from each state so that maybe a daycare up here, you might require a little more than New Hampshire, just for.
It depends on the daycare and if they're certified or not. There are certain regulations if they want to be a certified daycare or not, and if their children that are attending need to be vaccinated or not. If they're not, there's several daycares, as I'm sure you're aware, that maybe private or in-home daycares that they're not regulated by anyone, and so those, they may have their own rules, but ones that are regulated by higher powers usually have, they usually recommend or require vaccination. So it's good. It's a good question to ask when you're searching for a daycare, to ask
and
what
know what the adult has.
what the adults are required for working there. It's a great question to ask for sure. Yep.
Yeah, you folks have had your TDAP vaccines, correct? You said that? So I'd want to make sure that the daycare providers also had that.
Any other questions?
So I'm sorry, not to go too lengthily into it or anything like that, but could you just kind of talk briefly about like the volume of shots that an infant might receive, like the first 6 months, or like
Sure.
just like what to expect? Like,
I'll do the first half, and then you can do the first second. So I'll give you the reason why we do them early. So the maternal antibodies usually cover an infant for about 6 months. And so we usually start vaccines, starting at birth. We usually start with a hepatitis B, but usually we'll start with other vaccines at 2 months, 4 months, and 6 months. So by the time that they are 6 months and the maternal antibodies are done covering the infant can have some kind of immunity against these infections. And so, I don't know if you want to talk about how many they get, but
Yeah, so you're welcome to come and look at the CDC recommendations right here. The only vaccine that we give initially after a baby is born would be the hepatitis B vaccine. So hepatitis is a liver infection. It's a virus that infects your liver. The reason why the CDC recommends giving it to a newborn baby right away is because if mom had hepatitis B and we didn't know it for some reason, and you're usually tested during your pregnancy, but if you had it, there's a very high transmission rate from mom to baby. 90% of those babies will get hepatitis B, and it's usually bad. So some adults, you could get hepatitis B as an adult, and it's not necessarily a life-threatening infection. But when they get it as an infant, it tends to be a much more severe infection. And so that's the recommendation why they start early. So the only vaccine right away in the hospital would be hepatitis B. After that, a month later, you get another hepatitis B. And then at 2 months old, you get some other vaccines. There's one oral vaccine we give called rotavirus. It's a virus that causes really terrible diarrhea. You give that 3 times, 2, 4, and 6 months. So usually we're doing the same vaccines at 2, 4, and 6 months, or approximately the same. You can look at the chart, it gets very confusing. And so oftentimes we're doing one oral vaccine at the 2-month visit, probably a shot in each leg. Sometimes there's 3 shots depending on what your doctor chooses to do. There's different combinations of vaccines, which makes it confusing. Some include Hep B in their combo, others don't. It all just depends on what your provider opts for. And part of that is what you opt for. I mean, this isn't something that's told to you. This is a dialogue and a conversation, and helping you to figure out what is best for your child.
And the schedule that we have a large copy of the schedule that's recommended by the CDC, but the schedule that's here is provided based on all the studies that have been gone into it. So the schedule is based on the time they've studied things. So if we start separating vaccines and giving them at different times, we don't know what's going to happen. We don't know if it's going to be as effective. We don't know if there are going to be other side effects, but we can predict certain things if we give them at the time that they're recommended. And so that's why we recommend them at that time. And so we do get a lot of questions about changing the schedule and things like that. Vaccines of any kind are better than no vaccines, so we want to do vaccines, but it's very hard to predict what's going to happen if you do it at a different time than what it was studied. So we don't know, those things.
The other thing we're asked is that in the early first 6 months that they're getting lots of shots, lots of vaccines. And people think that that's maybe too many at a time. But an infant is exposed to 10 to 20 times more antigens that their bodies have to fight off every day. So the vaccines, the schedule is a reasonable schedule. I mean, it's going to work. People are going to get protected.
And I think the good thing about science too is it continues to get better and we continue to learn more. So there's actually we cover for more types of bacteria and more types of viruses today than 40 years ago. But there's actually way less total proteins that you're giving in all these vaccines. So in other words, when vaccines first came out, there were a lot more total numbers of proteins in the vaccine, if that makes sense. So they've refined vaccines, and they're getting better and better and better to spur an immune response without providing more protein or more antigen than you need to. Sorry, and I know you had a question.
No, I was just curious. I know you had mentioned that 6 months is typically the length of time with breastfeeding when the mom passes to the baby. Is that like a scientific time period, or if the mother breastfeeds for a year or longer, does that impact it in any way?
That's regardless of breastfeeding.
Oh, okay.
So they typically have an immunogenicity for 6 months from the mom, just being in utero.
Okay.
Whether or not they're breastfeeding or not. Breastfeeding has been shown to help even more, but that does either way, so even if they're not breastfeeding.
Okay.
So, and that's the reason. So when you're done at 6 months and they've had these 3 sets of vaccines, you can feel confident to feel like they have some protection on their own. Yeah.
And breastfeeding is going to be really beneficial for a lot of the common viruses that are out there. So in other words, if your baby's 2 months old and you're breastfeeding and you're both exposed to a cold virus, your body is going to immediately jump into action and start making antibodies, and you'll pass those antibodies on to your baby through your breast milk. So oftentimes, those babies have an advantage when they're being breastfed because mom's making antibodies for them and they're getting it through the breast milk. So with the everyday viruses, I think that can make a really big difference in terms of the protection that the baby's getting. Not as much from your measles shot you got when you were a kid.
Right.
So, any other questions?
Is a flu shot a vaccine, or is that
Mhm.
something? Okay.
Yeah,
It is.
that's a vaccine.
So I mean, what's your take on flu shot for?
For an infant.
We recommend it
for an
at 6.
adult, year to year.
We recommend it. You can't get a flu shot until you're 6 months old. It hasn't been approved younger than that, so you have to be 6 months old. So we do recommend household contacts to get flu shots, especially if you have an infant younger than 6 months, because they cannot be protected. And we do recommend yearly flu shots for everyone. So, and the flu shot, it's a difficult vaccine because they basically make their flu shot based on the year before's flu. So you're taking a chance whether or not you're going to protect it. And, this year has been a very good example of that. We have found that it was about 23% effective this year. But this is the first year in a long time that it wasn't as effective as it usually is. And it's usually a great vaccine. The vaccine we have covers 4 different types of flu, and so usually we get some good protection, but occasionally you're going to have that, you might have the chance that you're not going to get it.
But it's a good idea.
It's a
to
great
get it
idea.
To protect your child.
protect your child.
absolutely.
And yeah,
So,
we
like,
definitely
so-
recommend it.
Right, you won't,
For-
right, you'd
for
be less
you.
likely to pass on flu to your
Right.
baby.
Right.
So same
We
idea.
definitely recommend the
Pertussis.
parents to get it. Yeah, same as pertussis.
Yeah.
It's the whole concept. The more people that get immunized, the less likely you are to pass things around. Herd immunity type of thing. So,
I think an interesting point about flu, I think I have many people who feel like, well, I'll do all the vaccines, but I don't do flu. And I'm not really sure where that divide comes from. The flu shot is a new strain of virus every year, but it's not a new vaccine. The vaccine technology has actually been around for quite a long time. So we're not reinventing the wheel every year. They're just using mathematical models to try to predict what strains are going to be out there. And they weren't as good this year at predicting that. Interestingly, last year in this country, 108 kids died from the flu. 108. And maybe that's not a lot with the millions of kids out there, but half of those kids were healthy. So I'm not talking about kids on chemotherapy. I'm not talking about immunosuppressed kids. 50%, were healthy. So 50-something kids. And I just think that that's a risk that I don't want to take for my own children. I'm not, even if it's 50 kids in the entire country, it's 50 too many in my mind. And it's just, it's something that maybe not 100% preventable, but we can decrease the risk. And so, I don't see flu as a different kind of vaccine. I think it's similar to the rest.
Any other questions? Chris Reeder is here from the Immunization Service at the hospital. Chris, is there something you'd like to share with us?
I just wanted to say, I'm not an expert for the pediatric side of things, I'll just put that out there. But on the adult side, absolutely, I run a vaccine clinic at the hospital. So anytime for the parents of people or grandparents that need the Tdap, we specialize mostly for the pneumonia vaccines, like you were asking, and the shingles and the Tdap. We get a lot of dads coming over from the birthing unit. So you're welcome to come in for that. The other piece that we do, if your kids, when they get to be older or anytime, they're traveling out of the country, we actually do a travel clinic. So specialty vaccinations like yellow fever, typhoid, or hepatitis A, or things that they may not have gotten when they were younger. We specialize, and there's a lot of kids that even in high school, junior high, end up traveling to Costa Rica or places, around the country that need those extra vaccines. So we do see kids for the travel piece. Dr. Thibodeau, who's our infectious disease physician, I see him with her, and she goes through kind of a general discussion about the safety of travel as well. So, yeah.
Is it true when you give shots that they never hurt?
Ever. Ever.
just like in our office.
Of course.
What are the hours on that?
They're changing a little bit coming up. Our new hours are going to be Monday through Thursday, but we work pretty well. We can, if you call for the appointment, we can. And this is the brochure that was on your chair. We'll work with you and make sure that you make it convenient for you. We're pretty flexible. Yeah.
Thank you all for coming. If you have any individual questions, I'm sure the panel. Any other questions? Thank you again for all coming, and thanks to our panel who have done an absolutely awesome job.